Alzheimer's organizations, I found out that the chief is making about $450,000. That is compensation for feeding these people who are doing quote-unquote research on the different drugs. There will never be a drug which will reverse Alzheimer's, because Alzheimer's is the result of cumulative toxicities, toxic metals, environmental pollutants, natural synthetic hormones which are very toxic to the brain, and the products of fermentation in the liver and the bowel, and the liver cannot detoxify. We shouldn't have to really waste our time on looking for statistics as how many people. Just ask around and see how many people have good memory and concentration these days. Just ask a simple question. Well, probably you should not. But if you could, ask a question, what is your testosterone level? That tells you the truth. Every time I see somebody with a testosterone of over 750, that's nanogram per ml. This individual is over 65. And every time I see a young man with a testosterone level of over less than 150, every time he's less than 40. I'm talking about people who do not take testosterone or who are not taking any drugs which block testosterone. But here I want to go back and offer you something that we can do, something that nobody needs a penny to do, something that you don't have to travel to a retreat. You do not have to join an activist group to do that. I think I love activism. If activism is for reason and authenticity and honesty, I think that's a worthy cause. But to just look around and ask you, are the prevailing ideas of activism really hurting? Are they helping the unborn brains? Are they helping our babies which are not yet born? Are they helping toddlers? Are they improving the education? But I don't want to get into trouble because that's not my field. All I'm telling you is that I'm going to propose to you something that you will say, oh, Dr. Ali has really gone off the deep end. I mean, he is really, I know sometimes he comes up with these ideas, but today he's just outdone himself in absurdity.
We are doing the topic, aren't we?
Yeah.
Attention deficit disorder.
Yeah, well, they will know that he himself has attention deficit. Oh, everybody knows that. One time I said I have attention deficit, and one of the viewer was very, reader was, I said, it's a listener. I keep saying viewer and reader, can't say listener. So one of the times I said I suffer from ADHD. Well, generally that is true. I can never work on one book. I'm always working at least on 2 or 3 different books. But fortunately, if you work on 55 books, perhaps 40 will get published.
And some of them you can get right now, by the way, by calling 212-209-2950.
Get some calls.
And we have gotten some calls, every one of them so far anonymous, interesting.
Thank you.
One from Medford, New York.
Thank you.
One from Manhattan, one from Regal Park, New York, and generous ones too. So I want to thank you, anonymous callers, and please urge the rest of you. I'm going to try to pry from Dr. Ali those 7 tips for memory loss and Alzheimer's and ADHD, and how to increase your oxygen supply, magic oxygen.
No, supposing I spend most of my time on what I think is the number 1.
Which is?
I'm not going to tell you right now.
Okay. All right.
But listen,
number 1 ingredient that we can...
number 1 thing in both for children and for middle age.
Don't tell them yet.
For people who
Let's
have
see if they can pledge first. Pledge for some of these things so that they know more than just the one.
I already told them that my number 1 recipe for the health of the brain and the spirit of people of all ages, including unborn brain, is wisdom without words.
Wisdom without words.
That's my prescription number 1. But we need to, these 3 people who called.
Yes.
And who wanted to be anonymous.
Yes.
You know what the message to me is? What these gentle people,
forgot their names.
What these kind people, what these people are saying is that we resonate with your idea that you are fighting for preserving the institutional memory of Pacifica and WBI. And they are saying that we are aware of your problems, management problems, but we can rise above it.
We need the institution.
So the 3 people are saying, thank you. They are saying that, like you, we also override the day-to-day management problems and the frustration and the anger But you are talking about a lofty. You're trying to ask us to get to a higher level, a higher perch, and that is a perch of responsibility to preserve the continuity
at whatever perch,
at whatever
and sometimes it's higher and sometimes it's lower.
So thank you.
But it is something that we do. It is our only listener-supported stream of information that is not underwritten by corporations or anyone else. We own this air. You listeners and us broadcasters together, we keep the institutional memory alive. And that is what I think Dr. Ali is talking about. And to even bring up the idea of institutional memory when talking about memory loss and Alzheimer's and brain damage is really kind of brilliant.
Okay, listen.
A brilliant technique of getting people to. It is.
So
it
listen.
is. It is.
Let
It's
me-
important. 212-209-2950.
Let me say something. Since you asked me, okay, and I know the time will go fast, and some people will feel frustrated. You know what I personally find extremely valuable in care of children with on the autism spectrum? The most important thing for them is, you know, that liver is the guardian angel of the brain and the bowel is the guardian angel of the liver. So the most important thing is really cutting down fermentation in the colon. And as a specific thing, I will tell you what helps us most. We use Nystatin, Nystatin. Nystatin is an antifungal. You will have to plead with your doctor if he's not quite familiar with it. I can tell you that I have an article specifically how to invite people to become their own Nystatin doctor. It has nothing to do with cholesterol. Nystatin, Nystatin. Regular dose is 500,000 units 4 times a day. I almost always start with only half that dose, which is 500 to 250,000, and then I would sometimes start initially even with the twice a day rather than 4 day. Why do I say this? Because I have seen more initial results directly attributable to this than any other measure. Second thing, vitamin B12 injection. So I will tell you, you have to discuss it with your patients. On the radio, we really cannot prescribe specific things, but I can share with you what I do. I would give them 10,000 units of micrograms of vitamin B, hydroxycobalamin, and I would give them twice a week. So some people these days talk about, oh, B12 is bad for the brain. They belong to a different planet, okay?
B12.
Yeah, those people who are saying B12, I think they're talking about from internet to internet. I don't think these are the people who've actually taken care of 20 patients with autism and given them large doses of B12. Now, when we give B12, we always include it with, of course, magnesium and B complex, which includes pantothenic acid and redoxin. Now, the third thing, these two you have to find a doctor who, you know, and actually most doctors, if you plead with them, if they're sympathetic, if they know, and tell them, you know, they can read the stuff that I write. You know, one other thing you can tell them is that we have heard Dr. Ali say his golden rule, start low, build slow. So let's say if your doctor finds the idea of 10,000 micrograms of vitamin B12 injection twice a week very offensive, or he thinks it's going to kill your child, ask him, could you start with just 500 units, and 3 days later go to 1,500, and 3 days later go to 2,500, and 3 days later go to 5. This will actually encourage him. He can observe his. To be fair, if he's never done something like that, I think his hesitation is laudable. But that would be the suggestion, and he will learn something. He will learn that this is a wonderful technique, Dr. Ali's golden rule, regardless of what you do, start low, build slow. Now, what is the other thing that we do? We will put them on 4 weeks of anti-fermentation diet, which means no sugar, no dairy, and no gluten. This gluten story I've told you is grossly distorted. It's a very sad example of how corporations in America take over and blind everyone. The true gluten sensitivity is extremely rare. In true gluten sensitivity, you cannot have a bite of pizza even every 6 months without having major reactions. except for one person in the last 30 years, all the people that I've seen who told me they could not tolerate gluten, and I do believe them, every single one of them, when you cut down the gut fermentation, they can enjoy pizza once a week without any problems. So I think this whole notion, the real issue is gut fermentation, overgrowth of fermenting microbes, leaky gut state, excessive productions of mold toxins, which directly poison your mitochondrial enzymes, and brain cells cannot generate, they cannot develop, and in a child who is 4 years old or 2 years old, they will not. On a positive note, I've seen really wonderful results. I'm very, very optimistic about autism, and I started out being extremely pessimistic about 20 years ago. Now you can do a urinary organic acid, and you can exactly document. It's not that you have to hear somebody talk on WBI and say, well, WBI, look, take a 24-hour urinary sample, find out the mold toxins, and the lab will tell you what are the mold toxins. Lab will tell you what are the oxygen metabolites, Krebs cycle, succinate is the most important. But the point is, you will see that before treatment, they'll be way up these mold toxic acids, products of fermentation. 4 weeks if you do this program. Dr. Ali's gut fermentation protocol. I speak here faster, but please understand that almost everything that I say, if you go to my website, go to alihealing.org, you will get exactly the spellings and the details, everything else. I'm trying to tell you what our patients have taught us. And no, I am not interested in what autism websites are telling. The problem is I don't know who those people are. And I will tell you also, maybe I'm senile now myself, because I figured it out within two lines, the authenticity of the writer. Because the people who do the work, they write differently. People who do the work, they speak differently. You bring in a pathologist here without telling me as my guest. Within 2 minutes, I will tell you he's the pathologist, because his language is different. Okay, and if you know your stuff, you know the language of the other person. What else do we do? Well, we ask these mothers of children. This is true actually, even if I have seen people who were diagnosed with autism at age 2. Diagnosis was revised to Asperger's at age 8. And I have to tell you this story. It's going to take some time, but please listen to me.
Can we just remind everybody before you begin the story what number to call?
So then I will forget the story. I tell you what, you remind me what the story is. The story is of a 28-year-old boy. Okay. And you get some calls and tell him that 21-year-old guy that you saw recently who had one pressing problem. He kept on saying, I have to get one question answered. And that's the story. I want to share with everyone.
Okay.
But won't you please call us?
He needed one question answered, and
please
we need one question answered.
You need to call us. Call us for
212-209-2950.
Call us for your own reasons.